Have questions about your health? Well, the doctor is in. Dr. Janet Seabrook, Community Health Net CEO and all-around health expert. Dr. Seabrook wants to help because your health matters.
All right, and good morning, WLTH AM 1370. Today is Wednesday, and it's the fourth Wednesday of the month, and we are always get the opportunity to be graced with the presence of Dr. Janet Seabrook, Community Health Net, Your Health Matters, and just discuss some of the health issues and things that may be going on. But Dr. Seabrook is not with us today, but she did send some very capable and lovely ladies, and they're going to have some conversation today regarding centering on pregnancy. So there's been a lot of talk lately in terms of infant mortality in the state of Indiana, and so Community Health Net is actually taking on the task, and they're leading the way, they're leading the fight and leading the charge in terms of improving the odds in terms of infant mortality. Before I get involved in the show, I want to let our listeners know that the views expressed by the hosts and callers of this show are not necessarily the views of WLTH radio management, owner, and sponsors. And with that, I'm going to introduce these two lovely ladies. And I'm going to have you give a little bit of bio about yourself. We want to talk to Teresa Allen, so individuals that are listening in the listening audience can get used to your voice. And tell us a little bit about you.
Good morning. Again, my name is...
Hold on a second. That would be nice if I hit turn the mics up. Go ahead. How you doing?
I'm doing well. Thank you for having us. Good morning. My name is Teresa Allen. I'm a registered nurse. I am the nurse program coordinator for Community Health Net, and I help in the centering program that we have there at the health center. A little bit about my background. I'm actually a pediatric nurse. I've been a nurse for a little over 20 years. I've been on the inpatient side and on the outpatient side and done a little home health. So I'm very familiar with infant mortality and other things that have to do with pediatrics in general.
Oh, wow. Well, welcome this morning. We're going to have some conversation, and you're going to tell us about infant mortality. Dr. Seabrook and I have talked about it before, and it's startling and very alarming, the numbers in the state of Indiana. And now I have Maria, how do you say, Krista?
Krista, yes ma'am.
Krista. Mm-hmm. Why am I not getting you? Because do I have you on the wrong mic? No, I got you on the wrong mic, but I'm going to need you to pull the mic into you or just lean into the mic a little bit. Now you got there you go. All right. Now tell our listeners about you, because you're the coordinator, one of the coordinators.
Yes, ma'am.
Okay.
Good morning, everyone, the listening audience. Thank you as well for having us. I'm excited, about everything that I'm doing with Community Health Net. My name is Marie Chrysler. I'm a medical assistant / CenteringPregnancy coordinator, as well as a facilitator of the program. And I have been with the company almost 8 years, but I've been in the medical field almost going on 10 years. And I'm excited, to be even representing Dr. Seabrook in reference to the excellent program about centering pregnancy. So I'm excited, just going forward and everything that this program is bringing to the community, as well as the growth, for Community Health Net.
Oh, wow.
Yes, ma'am.
That sounds great. So tell us a little bit about the centering program.
So I'll start. The purpose of centering anywhere is to reduce infant mortality and to reduce preterm birth and to reduce low birth weights. So we'll start with infant mortality. Infant mortality simply means the death of a child less than 1 year old. And so what we want to do is to reduce those numbers. We want to make sure that children live past, when they're born, that they live a healthy life. And part of our centering program, which Marie will go in depth about, helps to reduce those numbers. Preterm birth simply means any birth before 37 weeks gestation. Normal birth is between 39 and 40 weeks. So so preterm birth is anything before that 37 weeks of pregnancy. And low birth rate simply means that the child was born with a birth weight less than 5 pounds, 8 ounces. They consider that a low birth weight. I looked at a couple of statistics, and it looks like since 2012, Community Health Net continues to document improved overall birth weight outcomes, and we believe that some of that is due to our Centering Pregnancy program model. And again, like I said, Marie's going to share with us our model and how Centering actually works.
Okay.
At any rate, 68% of the moms receiving prenatal care at our health center, they choose to enroll in our and participate in our Centering Pregnancy program, which is a great number. 68% of the overall population of our pregnant moms are in our program. The inception of our Centering program took place back in 2012. And every year since then, we've been able to deliver 330 plus babies per year. And we expect that number to grow now because we have added OB at another one of our sites. So at the end of this year, we'll see what that really looks like since adding OB. Now, I'm not sure if everyone knows, but Community Health Net is a federally qualified health center. And that means that we qualify for funding under Section 330 of the Public Health Services Act. And in 2012, we actually became a funded Centering Pregnancy site. We are certified by the Centering Healthcare Institute of Boston, Massachusetts, and we have to recertify yearly. And so I did put a little data from the March of Dimes, which talks about preterm births, and it looks like overall preterm births has been decreased in the country, in the United States. So that's a really good thing. And we want to say that we want to credit some of that to, different centering programs across the United States. So we're really happy about the decrease, overall in the country. So I want to turn it over to Marie and let her talk about what really happens in centering, why we have centering, what goes on from the beginning to the end.
Yes, I'm excited. First of all, I want to give a little history. Not going to go deep into detail, but just to give a little briefing of the vision that came about in reference to centering. This vision came about over a little over 25 years ago by Sharon Rising. She's a certified nurse midwife that came up with this excellent vision. And now over 500 centers and more are doing their prenatal care in a group setting, concerning the vision that was, came forth by Sharon Rising. And I want to read a little something, in reference to, Sharon Rising. It says, Centering Healthcare Institute is a nonprofit established in 2001 by Sharon Rising that aims to improve health by transforming care through centering groups. It said the organization has worked closely with healthcare providers from all sectors to change healthcare. With over 2 decades of experience and innovation, Community Health Net Centering Health Institute has become the go-to resource for group care. It has developed and sustained the centering group model in more than 470, and just through further research is over 500 now, practices and sites, and within some of the largest health systems in the world. Now, however, I'm excited because Dr. Seabrook has came up with this vision, and has caused this program to go to a whole nother level, by bringing it into Indiana. And may I say that we are the first certified center in Indiana to be doing Centering Pregnancy. And not only have we catapulted to a whole nother direction, we're doing it at another site, which is our Hammond location. Now, I want to talk about centering, what it's all about and how it goes. Imagine 8 to 12 women coming together, doing their prenatal visit in a group setting for up to 10 sessions, and how they're selected between 12 and 16 weeks gestation, and nothing changes Only thing changes is they're doing their prenatal care in a group setting with myself and the provider and other trained facilitators. And they will do their first 4 sessions every 4 weeks. And then their next 6 sessions, they'll do them every 2 weeks. And they'll do the sessions for up to, for 160 minutes, which is 2 hours. And once they complete the program, after they have their babies and all that, we bring them back for a big old baby shower. They get a certificate for completing the program. And the program is designed to empower the women, educate them in different areas throughout their pregnancy. And what I love about it, when the moms come together, all that journey is, you can say that it's almost a year that they're together. They become like a family. So each one of the patients become familiar with one another, because they're interacting, they're learning different things, and each session serves a key purpose. They're learning about breastfeeding, nutrition, labor and delivery, pediatric care, postpartum, everything they need to prepare them before they have their babies. They're being empowered, and they're learning about these different things in pregnancy. And however, a lot of the testimonies that I've heard from different patients just by doing centering pregnancy, they come back and say, well, Miss Marie, and I know they tell the provider as well, because I've done centering, I didn't have to go to the hospital for every little pain that I feel, my back pain and different things. So I love that part because they are empowered through centering, they have learned so many things to prepare them for that. And however, I love the fact that the new moms that come in and are a part of centering, they're being empowered because they're coming into group setting with moms who have already given birth. So they're empowering one another.
Yeah.
Yes, ma'am.
So there's no specific age range in this group. It's just the women who are between 12
and 16 weeks gestation. Yes,
okay.
ma'am.
Okay. So that's awesome. But some of the things in terms of what they focus on, I know you said breastfeeding. Mm-hmm. Do they do the formula all of this, or how does that work too? Well, they discuss it, or they learn about it, or.
Absolutely, and that's a good question. Each one of the sessions, either it's going to be the provider that discusses the different topics, or we have someone that comes in, that's licensed in different areas for the each topic, because each topic has a key concept that we're targeting. So we may have someone that come in, just like we have a lactation personnel that staff with us named Cassandra Jackson. So she will be one that we use for session 3, which is in reference to breastfeeding. And then the first session, when they first start and become a part of centering, is in reference to nutrition. Then we have a session that talks about dental, which we have a personnel that will come and and talk about dental, from Cool Smiles named Lamar. And then also we have a session where we would do a tour to the hospital, which I love because the moms are going to the hospital, they're meeting the different nurses, and they're going, just being prepared for when they go over to the hospital, what they can expect and all of that.
Is there any, because that the frightful thing is Lamar, so do you actually go through that whole thing in terms of learning what you're supposed to do, or knowing what you're supposed to do when it's time to go to the hospital, when it's time for the baby to come? Yes,
ma'am. Another excellent question. Absolutely. Actually, Leah, she would talk to them in reference to that, and she's preparing them. Then also we have excellent information through videos and whatnot. If just say like if the provider is not able to be there in reference to that, we have excellent videos that we will show the patients, preparing them, for labor and delivery, in different areas that prepare them, before they get to that point of, of delivering.
And I know, Teresa, you mentioned that you recently added an OB to this. So is this the OB, is this the person that is going to actually deliver the baby, or you just have someone to come in and discuss with them what to expect and different things?
So Community Health Net has 6 sites. And in our Hammond site, we have just recently added OB to that site. I believe it opened in November of 2018. We have a certified nurse midwife who actually does, we just had our kickoff Monday at the Hammond site. And our certified nurse midwife is a part of our centering program, and she actually sits in, with them during the centering visits. So yes, we have added OB to our Hammond site, and centering does take place there. We've had 2 sessions so far. So I just wanted to give our listeners a little bit of an imaginative view of how it looks. So centering, when you come in, you're actually in a large circle. All the women are together in a circle so that it'll feel like everything is centered around them. So they come in, we teach them how to do their own vital signs, so that gives them some buy-in to their own health care.
And when you say vital signs, what are the vital signs?
They learn how to do their blood pressures, and they learn how to read the scale. They step on the scale, get their weights, and we talk about weight gain, weight loss, things like that. They learn how to actually get their blood pressure, take their blood pressure. We give them a centering book that every time they come in, they write down their vital signs so that they can keep track of what it looks like for them during their visit. So after all of that is done, we always prepare, I'll say, a nutritious breakfast for them. So we'll have things like bagels, fruit, water, granola with some yogurt, things that will keep them healthy. And so that's what we're trying to, get them to do, is to eat healthy throughout their pregnancy. So after they have their little breakfast, they come together, they talk about the day's topic, and we don't really it's not really like a teaching session. It's more like facilitating and getting the women to come together and talk about the different subjects, like how to prepare, what do they do to prepare a nutritious meal, for instance. So they get to talk to each other and bounce ideas off each other, and that's what makes this model a little bit more embracing, and it puts them in a comfort zone to where they can be comfortable, talking to each other and learning about each other.
Yes. All right. I'm going to put a pin in that right now, because we have a caller that's on hold. They're going to ask you a question, and we'll take the caller, and then we'll come back and discuss some other things. Okay. Caller, you're on with Teresa and Maria. How are you? Thank you.
Fantastic. So during our sessions, one of the sessions, we do talk about postpartum and what happens in the postpartum visit, and that's where we talk about, we give them education about birth control and birth prevention, safe sex, just all of that. So yes, we do incorporate that into our centering model.
So sexually transmitted diseases as well.
Absolutely.
What about, we didn't talk about, because we know there's a gestational period for diabetes, as well as there are some women who have difficulties with birth. Are these women part of the group, or are they treated differently?
No, ma'am. Okay. We do incorporate what we call high-risk pregnancies. Mm-hmm. And those are women who have, like what you just tapped on, gestational diabetes, or they may have high blood pressure during their pregnancy. So we do incorporate them into the group, and they bring a whole different enlightenment and a whole different type of sharing as to what they're going through in their particular pregnancy. Now, other women may not be going through that, but if they have future pregnancies, that that gives them things to look, to signs and symptoms to look for, so that if they're at home and they're not feeling well, and they can think back and say, oh yeah, I remember such and such saying when she had diabetes during her pregnancy, and now I'm feeling a certain kind of way. Maybe I should call my doctor, or seek out some help. So yes, we do incorporate women with high-risk pregnancies. That's part of the centering model across the United States.
Yeah. This is Community Health Net, Your Health Matters, and today we're speaking with the program coordinator, as well as the coordinator itself at Community Health Net, and they're talking about the centering program, Centering Pregnancy program, and we want to thank them for coming out. Dr. Seabrook is unable to be with us today, so we're just having some conversation around that. Now, as we talk about, the caller mentioned unwanted pregnancies. and sometimes mothers struggling in difficulties. I heard you say something about cribs, or you provide certain things, amenities for the mothers who attend or complete the program.
Yes.
Okay.
Yeah. I'll
Yes.
let Marie talk about.
Absolutely. Even with Methodists, after the women give birth, they're given a car seat, and they're also educated of the importance of breastfeeding and and safe sleep, and just different things to prepare them even before they even before they leave the hospital. However, one of the three components and concerning centering components of healthy assessments, interactive learning, and community building. So the healthy assessment is the women being more involved with their own care, recording their blood pressure, learning different things is very important, because they're seeing their journey. How was they weight before they became expected moms until now. Then they're recording their own blood pressures, and they're excited about that. And I noticed that when the patients come, they're excited to to write down their own blood pressure, taking their own weight, looking at their BMI levels and all of that. And then also I want to also add that even just to piggyback off what Teresa was explaining, as the moms are sitting in the group circle, there's also a part where the provider is set up in a corner, and it's kind of discreet, where they still have privacy with their one-on-one encounter with their provider. And how it's done, we have like beautiful soft baby music playing, and so the only thing that the provider is doing in that corner, listen to the fetal heart tones and measuring the bellies, while the group is still sitting in a circle, communicating with each other. But the soft music is to drown out, like if the patient have like a private question that she want to ask the provider. So everything is still kind of discreet, but yet when we join in group circle, everyone begin to ask different questions and whatnot. And what I love about that part is just sitting back, facilitating, watching the mom's face as they're asking these different questions. And then we have the new moms who may come in there. They're just this is their first baby, and they're kind of scared, and they may have questions in their head. But what I love about it, the moms who are already have children, they're empowering them. I'm gonna use for example one of the moms that may say, well, I be having these back pains, and my feet swelling up, and just different things. I'm using them as examples. But the mom who is a new mom who never had children, she's being empowered because she is opening her up to begin to ask questions. So they're empowering one another, all around the circle, and everything, it's just flowing together the way that we want it to flow. So what we use is an approach that I love when I did the training. I'm not trying to go off what we asked, but I want to bring this up because this is important too. So how it's done when we're facilitating the groups is a key dyad that we use in centering, and it's called the ARR approach. The A stand for you acknowledging the patient who is asking a question, and we always tell the patient, don't ever think that what you ask in reference to centering is a question that's stupid or anything like that. We want to make them feel comfortable, and we want to have them where they're engaged in asking different things. But the ARR approach is you acknowledging the patient, you responding, and then you referring. And what that means is you referring and giving them the opportunity to answer them questions for themselves. Do that make sense?
Yes, it does.
And so that's why it's centering, because everything is about the patients. Mm-hmm. And so we are informing them and educating them to keep opening up, because everything that they ask is very important.
Yeah, they may have the answer themselves, and it's deep within them.
Absolutely.
And which brings up another point, and I'm gonna go back and kind of reference postpartum. Mm-hmm. One of the things is you got this little person now that you're responsible for, but we talk about the depression side of that. Now, is that something that is also dealt with through centering?
Yes.
Or is there someone that they talk to regarding that? Because now when I take the baby home and he's up crying all night, then what am I going to do? I can't go back, or how do you equip me to handle that?
Absolutely, and I love that you answered that. I believe in one of the sessions, getting close to the patients completing centering, I believe in session 7, that topic is talked about through the provider, and she does an excellent job in explaining to them what they need to do if they're feeling that they want to harm their baby, they're feeling sad or anything. So they're prepared in that part as well when we get to that session. So that's dealt with, with the provider talking to them. Then also we have psychiatrists on staff that is able to assist the patients if they're going through anything like that. So the way that it's done when the provider, open them up to that discussion is having them, know that, okay, if I'm going through this, I can talk to my provider, or I can come to Community Health Net to get that type of service if I'm dealing with postpartum depression or anything like that.
We also have a collaboration with the Healthy Start program, where we bring in a person to actually talk to the pregnant moms about different things that they may need in terms of social services. They introduce them to WIC. They introduce them to the Safe Sleep program. So they fill out a form and they send it off, and then the moms are able to receive like a Safe Sleep crib, a pack and play, and they also make sure that the breastfeeding moms have breast pumps.
Yes.
So there's a lot of things that are involved in making sure the mom's needs are met overall. So it's like an overall from head to toe type of assessment, and making sure we're meeting the needs from head to toe. Their mental needs, their physical needs, social needs. So when they leave centering, our goal is to make sure that they have everything that they need to prepare for a healthy delivery.
Okay. Now the next thing you want to talk about, and we talked extensively about the mom and what we're doing to help the mom, but there's always some things in terms of diet, and then when my baby does come, what happens if my baby comes early, and now we're at another point in the hospital where I may have to be there, or my baby may have to be there for an extended period of time.
So during their tour through the hospital, they show them not only the labor and delivery wing, but they also introduce them to the nursery, the neonatal ICU, and the step-down unit, and they also introduce them to the postpartum side. At Community Health Net, we do deliver with Methodist Hospital. That's where our deliveries take place. And Methodist has their setup where they have a nursery and they have postpartum. So, and they have the neonatal ICU. So they talk about if you have a preterm baby, your baby might go to the neonatal ICU to be taken care of, to get them through those moments that they may be a little despaired or having some problems, and they introduce them to the neonatal nurses, who are fantastic. So they get that whole experience. Yes. So they'll know if something happens early, I have a place to go. There's going to be people there to help me. Yes. These are people who have had the education, the skills. I can't say enough about the Methodist neonatal ICU. It's a level 3. Yes. So that speaks volumes for itself.
I just want to mention, if you're tapping on the desk, it's actually echoing in the mic, so I wanted to let that's what I keep saying, because it picks up, it's very sensitive, and it picks up and it sounds like it's rolling thunder. Okay. We have another call, and then I have another question that I'm going to ask. Good morning, caller. You're on with Teresa and Maria from Community Health Net. One of the other things is that we talked about too is we talked about in terms of baby, the infant mortality. What are some of the things, like sometimes, a lot of times you didn't know about laying the baby on the stomach. You didn't know, I found out later about the covers and different things like that. You want to talk about that? And also, if they're laying on their back, what happens if they're ingesting formula? So these are all things that contribute to the mortality rate.
Absolutely. Yeah. So first of all, let me say that we would never ever encourage any mom to lay their babies on their back to feed them. They always should be up in their arms in a cradle position when they're doing breastfeeding or bottle feeding. We always encourage moms to never ever lay their babies down with their face down. When they're putting them down to sleep, we teach them to put them down to sleep on their backs. Now, the one thing we do stress in our centering program is wherever you lay your baby for rest, that nothing, absolutely nothing else is in the crib or in the bassinet with them. We encourage moms not to cohabitate with them in the beds.
Okay.
We want them sleeping alone in a safe area where there's nothing else like in that area. No teddy bears, no toys, no anything like that. Just the baby and the crib.
That's different because everybody, you got this little person coming in and you got all the bells and whistles,
Yes.
the blankets, and everybody's bought a bear, a toy, and they want their toy there. It's just so much that you do for these little people when they come in because it's just a new life and with the excitement.
Yeah, and unfortunately the new life with the excitement sometimes brings about accidents and things like that we really don't want to happen because we always have what we call developmental milestones, and babies should be doing such and such at such and such a time in their life. And but babies do things pretty much, while we have cut off, like at 0 to 3 months, they should be lifting their head. Well, they may be lifting their head when they come home from the hospital. Yes. So you never know when your baby's going to roll over and reach for something, and you don't want anything in the bed with that baby, especially while you have laid this baby on their back to sleep. And then you go and you're going to take a nap, or you're in the kitchen cooking, or you're not always with the baby during that restful time. So you don't want your baby doing doing things that you didn't expect for them to do.
That's right.
So that's why we always say, even if you have a shoebox, and that's the truth, if you have a shoebox that you can put your baby in, as long as nothing else is in that box, your baby is safe.
That was my joke of the family because my dad said that I slept in a drawer, so I wasn't even in
A drawer?
Yeah, he put me in a drawer. So, but it's interesting, and it just seems like as time goes by, babies are more advanced and they're doing things a lot quicker.
Absolutely.
So, and before you know it, the baby could have rolled off the bed or different things, and the mother is absolutely horrified because of something that movement or whatever that they didn't really expect, and now you're dealing with, as you said, with the accidents and so forth.
Yeah.
What about their interaction with other siblings? Because sometimes they go home and they've got older siblings, and wow.
Yeah.
Can I answer that?
Yes.
You know what? In reference to that question, what I do, and as we're going on a journey with the moms during the centering sessions, we discuss different topics. And what I tell the moms, make the children who are already here more involved even before the baby come out. By having them, encouraging them, like, you're going to have to be a big sister, you're going to be a big brother. So if you have them being more involved, like that, they get excited. They tend to get more excited because they're excited that you're involved with them even before the baby come out. So, and I feel that what happens when they do that, it keeps the other child from being jealous. Like, I'm not the only one now, there's a new one here. But if you make them feel more apart, they tend to, love that baby just as much as you love it. So I always tell the mom, I encourage them, let them rub your belly, let them talk to him or her who's on the inside of you, because once they get here, you want them to feel excited. Oh, my baby brother is here, my sister is here. So that's one of the key parts of centering that I love, when these moms have them babies and they bring them back to share, to share with us. That's a blessed moment for me. And I'm telling you, from the top of my head to the tip of my toes, I love centering. And because of, and not trying to go off but I have a lot to say in reference to centering. But I want to say that even in that, even as the moms are coming together and we go on this journey with them, that key part of them coming back, sharing that with us is such a blessing, because they allowed us to be on this journey with them. And then when they come back and we seeing the beautiful babies, that's just a blessed moment to me. And it's such an awesome program.
It really is.
Yes, ma'am.
Sounds like it is. Except for my son, if I brought, by the time I brought the third sister home, he was ready for a brother, and it was like, not another girl, not another girl. So he had some issues with that. So, but I understand what you're saying.
Yes, ma'am.
But it's very important. It seems like this holistic approach. So if I come to Community Health Net, and a lot of times I'm already 2 or 3 months in, or sometimes I may not. I may just be early in 6 weeks. How do I get introduced to the program? Do you ask me? Is it a voluntary thing, or how does that work?
Okay, that was a great question as well. However, when the patients are coming in, they must be an established patient with Community Health Net, and how they're recruited in, myself, and as well as one of the other trained facilitators, how we recruit them is a OB data that I will go in and look at and see what potential patient can be a good candidate for centering. And we'll look in there and look at their gestational age, however they start between 12 and 16 weeks. So as the provider review, which patients is a good candidate for centering, then I get the information back, in reference to the list of patients who are on there, then I begin to call them. And what I do, I'm always excited about this program, so it shows in my voice. So what I would do, I encourage the moms, I give them the importance of the program, making them to understand that this is your prenatal visit just as well as you was having a one-on-one encounter with your provider. The only thing changes is done in a group setting. So I tell them about that, and I give them a little history about centering, but I keep the punchline for when they first come in for their first session for centering. So I get them excited from the beginning, and then I have more yeses than I do nos, because I'm telling them about the centering, what's it about, it's empowering, and all of that different information. So the patients, when you let them know how excited you are about something, it tends to draw them in.
So how long does centering continue? Does it go on for the first year of the baby's life, or do we extend beyond, or how does that work?
Well, actually, once the, just as I spoke before, after the patients have the baby, we do bring them back for a reunion. And then also when we bring them back for the reunion after, I believe it's 2 months after we have the baby shower, then also we have a 1-year anniversary as well. And that part I love as well. Yes,
And
ma'am.
I just want to add too that now that we've had our centering program up and running since 2012. In the very, very near future, we're going to be having something called Centering Parenting, and that'll involve the pediatricians and the babies and their parents and families, and it'll be modeled very much like the Centering Pregnancy program, only now the baby's here. You're having your pediatric visit. It'll be in a group setting. You will still be able to get all of those things taken care of during your normal pediatric visit, only it'll be in a group setting, and you'll be able to, bounce ideas off the moms and the babies, and they'll probably be toddlers by the end. They'll be able to meet each other, and so it'll be like a big romper room.
Yeah.
That's what I imagine.
Let's take a quick call. Good morning, caller. You're on with Teresa and Maria from Community Health Net.
The Martin Luther King location is planned to be opened sometime early this summer. We all know that the building is there. We're furnishing it. We're very excited about it. We just got to get them doors open. So if Dr. Seabrook was here, she would probably have a better idea of when that would happen. But as an employee of the health center, I am involved in some of those type of meetings. So the most that I know right now is that it'll be sometime early this summer. Absolutely.
Have a great day.
Thank you.
Bye-bye. And so you said it's centering at all the locations, because you got Maryville, you got the Philistine Center, you got Gary. So where would they have to go if they don't have a centering location? If it's not at the other ones, do they go to Fifth Avenue? How does that work?
Absolutely. Very good question. So centering happens at any of our locations that has an OB department. Right now in Maryville, we don't have an entire OB department. We do have someone who comes on a few days a week to see some of our high-risk pregnant patients. So right now, centering is taking place at our Fifth Avenue site, our Hammond site. We do anticipate having OB at our Martin Luther King site, so centering will definitely take place there. Like we have a Miller site, there's a pediatrician there, so we're anticipating our parenting maybe parenting to be there. But anywhere we have OB, that's where centering takes place.
All right. Okay. Well, certainly want to thank you, ladies. You came in with a lot of information, and as we think about extending the life of those young babies and even helping the mother in terms of coping, because it's a lot. Becoming a parent, there's a lot that's involved. So I certainly appreciate you just stopping by today to take the time out to have the discussion.
Yes, ma'am.
Thank you.
All right. So with that, any final words, any closing words in terms of the hours? Because they don't know the hours, so we want to make sure that if any individuals heard, or maybe they can refer someone to the facilities for some care.
Absolutely. To our listening audience, if it's anyone that you know that's struggling and do not have prenatal care, we encourage them to come to Community Health Net. We welcome them in. They'll be well taken care of because we have different physicians on site. That we have the OB department, we have different pediatric, and we have family practice. So any patient who needs care, any type of care, is welcome to come to Community Health Net. And also concerning centering, I encourage moms who need different information, who need to be empowered concerning their prenatal health, to be more involved in, keeping their visits, because that's very important. Because when you know better, you do better. So what I love about centering, that these moms, just through research, are learning different things to prepare them, and it is more interactive health. They're learning about different things, the importance of keeping their prenatal visits for the sake of themselves as well as for the sake of them babies. Mm-hmm. So I just encourage them, just keep going to them prenatal visits, getting all the care you need, because in the long run, it's going to be a healthy outcome, and it's going to be a blessing for that mom as well as that newborn.
Absolutely. We've come a long way from the grandmothers or the older women that used to boil the chicken on the stove and tell you that was going to help you have an easier birth or different things. There were so many wise tales out there, but I really thank you for encouraging women because it is important. It's important for the health of your baby.
Yes, ma'am.
So thank you, ladies, so much. And I'll tell Dr. Seabrook I really enjoyed talking to you. James, you had an easy job today. You didn't have a whole lot of work to do. So we know that it's Dr. Seabrook that does that, isn't she? She cracks that whip. But thank you so much, ladies.
Thank you for having us. We appreciate it.
Yes, and with that, I'm going to turn you back over to automation. I really want to thank Teresa and Maria for coming out. I was going to say it kind of makes you want to, but no, it doesn't kind of make you want to do that here. I can just raise them from being a grandmother, so don't have to go get one to experience it, but they have a lot of wonderful things that are going on there, and make sure you take care and stop by and look into it, because Community Health Net, your health matters. They're here to tell you about centering on pregnancy. Have a great day.
Have questions about your health? Well, the doctor is in. Join Community Health Net CEO and all-around health expert, Dr. Janet Seabrook, every fourth Wednesday on WLTH 1370 AM. Don't be shy. Call in and ask your questions. Dr. Seabrook wants to help, because your health matters.